Hello, All-Star listeners, and welcome to another episode of the Veterinary Roundtable presented by All-Star Veterinary Clinic, the podcast where we answer your veterinary-related questions while having some fun along the way. If you enjoyed today's episode, be sure to leave us a review on your podcast provider of choice, and if you have any feedback to offer to improve the Veterinary Roundtable, let us know. Please write a review. It definitely helps, and the reviews if you can write them on Spotify or Apple Podcasts, they help boost us in the algorithm. So any reviews, we love them. Let us have them. Good, bad, whatever. 65 Spotify reviews. Okay, that's good.
That's a good number.
That's a good number. All right, let's see if we can hit 100. Also, we need to promote Chowder Caught a Cold. It's a book that our own Kristen Pulse, DVM, one of the veterinarians here at All-Star Veterinary Clinic, wrote, Chowder Caught a Cold, and one of our registered technicians actually did all the illustrations. And it's really cute. It's really clever. So check it out. There they are. The working duo. Okay. You can find it on Amazon. So go grab yourself a copy and read away. There will be new adventures for Chowder.
It's a good book.
Soon. So, yeah. Very cool. All right, you're up, Faust. You're doing introductions.
What? I thought you
I knew that was going to catch your off guard.
I thought you already introduced us. Oh
okay,
my gosh, did I miss that? Okay, on today's episode, we have myself, Dr. Emily King.
No, how's Faust?
No. Oh, I thought I was introducing everyone. Bless.
This is the best introduction ever.
This might be my new
favorite.
favorite.
I think it is. This is Faust. There we go.
Yeah, yes, this is me, Faust. Oh gosh. Room assistant Becca, registered vet tech Elise, and my co-host Dr. Emily King.
There you go. There you go.
Nailed it.
Did it.
How's everybody doing with the Tuesday after a holiday?
Well, I got here like 20 minutes ago, and surprise, I'm on the podcast, so it's going great.
Okay. Good.
My brain feels like scrambled eggs just a little bit. So, but we're chugging along.
There's good and bad things, right, about having Monday holiday. The good thing is there's only 4 days in the week. The bad thing is there's only 4 days in the week. It all gets squeezed into 4 days, I feel like.
McDivitt brought cookies. So that
makes
everything
better.
Ooh.
Cookies for breakfast.
Yes, that is
I
what
mean,
I had for
we are
breakfast.
adults and eat normal breakfast, right?
No.
No.
Well, I had my normal breakfast, but then you walk in and see cookies, and you're gonna have that too. So
That's
double breakfast.
She literally walked in the door and I was like, cookies.
yes,
That's the way to Elisa's
Yes.
heart. Chocolate and cookies.
Yeah.
Oh my gosh.
and wine.
And wine.
and wine.
There you go. All right. Icebreakers for today. What show on Netflix did you binge watch embarrassingly fast? Elise?
The show is not on Netflix.
Okay.
But it's on Discovery Plus. And now I can't remember what the name of it is, but it's a show about extinct animals. And this one specific biologist, I guess he's a biologist, Forrest Galante. I don't know if that's how you say his name, but he picks us an extinct species.
Harrison, help us out with the name.
Tries to see if they're truly extinct, or there's some rumors that they're still within the area, so he goes to that area, and there are some that he did find, there is a tortoise that he did find that they thought was extinct, and he found the tortoise.
Really?
And I binge watched it within a week. It was super interesting.
It was super interesting.
And then I had all these facts, and I came to work with all these facts, and people were probably really annoyed that I kept talking about all these facts of these extinct animals. Some of them are no longer extinct. Okay, that tortoise was found.
That's fascinating.
But yeah, I did. I watched
Elise
really
always has
fast.
the best
So
fun
does it
facts.
go from the extinct list to the endangered list? Is that how it goes?
Yeah, and there was evidence of a panther that he found, but there was one he actually picked up the tortoise and was like, "This is the tortoise."
Did he say it like that?
Yeah, he did. He
I
did.
think I'm going to need to watch this.
Now your
This is-
greasy hands are all over.
Yeah,
me.
yeah, exactly. Now he's gonna die. Because
Well,
you
I
can-
learned.
Yeah,
I
tortoise.
actually learned it was a female, and apparently in tortoises, everything is very slow. And if they mated years and years ago, sperm can still be viable.
No way.
Yeah, and it was and she was an unhealthy weight. So if you they're gonna rehabilitate her back to a healthy weight, and if she's healthy, then the sperm can do its job.
Wow.
I thought that was really
Fascinating.
interesting.
Hmm.
Yeah, it is called that.
Extinct or alive. Oh, that sounds very interesting.
May have to look that one up.
I know, me
I'm
too.
intrigued.
I got Discovery Plus
should probably shut this
specifically
off.
for that.
I'm
show.
intrigued too because I I wondered often if they list things as extinct, but they really aren't. Like if there's financial stuff involved, like
Well, some of them, like, they live in so, like, desolate and remote areas that, like, not many people venture. And so I think the extinct list is, like, based on, like, the last time that they were seen.
okay,
And so, like, if there's not so many, like,
sightings.
sightings within so many years, they kind of, like, assume. And, like, there's things like deforestation in the rainforest and such. And so they're kind of like, well, we haven't seen these. There's also no proof. Like, there's no other proof. So they kind of deem them extinct. So some things are extinct that may still be out there, or they're really good at
You're a
hiding.
book of knowledge.
Thanks.
I was just thinking that. I'm like, why have we not had these interesting conversations before? Because we don't have 1 minute in the day.
Exactly.
Yeah, that's
I don't know
why.
how you
To
miss
talk
it.
about fun things like
multiple
this.
times Elisa's come bopping around the corner and goes, "Did you know?" And I love it. It's one of my favorite parts of the day. Like, just
Don't
those
leave me
random
out.
fun facts.
I know
just
a lot
saying.
of things, a lot of weird things.
Just saying.
She's definitely who I'm picking for Trivial Pursuit next game.
The game's hard.
Ugh. Yeah.
Listen, I love trivia. That's what I do on my weekends. We go to the bar, we go to trivia.
Oh my
So
gosh.
yeah, I
suck
do
at
need
it.
a lease for the animal facts is what I need.
All right, your show, Becca. What do you think?
So I've done it a couple times with shows because I will hyperfixate on something, but one of the most recent was Yellowstone. I was watching it, and then next thing I knew, it was like 4 a.m, and I was like a season and a half down. No idea what happened. And then my brain switched off. It was like, okay, we're done with this show. So I've been struggling to get back into it because I'm not completely done. But I'll do that. I will hyperfixate on a show. And then next thing I know, I'm like, what time is it? What year is it? What has happened? So Yellowstone, I've done that too. There are a couple, like, I was watching Ghost Adventures last night, and I think I watched about 4 episodes without realizing I'd watched 4 episodes.
Yeah.
Yeah, it's bad. But in any of those, like, crime, mystery, things like that, the paranormal stuff, you can suck me in real fast with any of those.
Thanks.
So got it. Faust won't come over to binge
No.
watch those with me.
Nope. Never.
So since you live in silence, do you binge watch your shows?
No, Tommy and I watch a couple of shows a day. And recently the binging is Heartland.
Oh, yes. I binge
We're
watched
on
Heartland too.
Season 8.
18.
As of, I know, right? As of last night, season 8. And yeah, that's been the only show we have watched since we started it. And I don't remember when we started it.
That's so funny.
It's giving me a better appreciation for horses because
I know.
I'm super scared and don't like them. And so now I'm like, they're kind of pretty.
Right. Well, when you have that
Taking
land like
baby
that
steps.
in Canada and it's like they can run,
Mm-hmm.
you know,
Yeah.
but yeah, they are kind of like the cats of our world.
I know, like all the behavior stuff
Yes,
in that show.
that's-
I was
yes.
like, fantastic.
Yes.
And I'm just like thinking of like, that's, like with the cats. Yeah. And dogs the same, but yeah.
Yep. I liked that one. I would say the one that embarrassingly fast I watched was called The 100, and it was horrible, but I just couldn't stop watching it. It was the sci-fi about kids who got dropped on a
I heard that's bad.
like in an island. They got dropped, or the spaceship is gonna, I don't know, something.
Oh, I know.
And then
which one you're
they send
talking
all their
about.
kids down to see if Earth is still viable or
like
something.
an
Because
older
isn't it
show,
like, yeah,
right?
I think it came out when I was in high school or in
Yeah.
college, but yeah,
Yeah.
it's like the Earth, there was like a nuclear war or something, so they had taken a few of them on. I think they called it like the Ark or something.
Yes, something like that.
And then the
Yeah.
Ark was running out of oxygen, so they took all the kids that had ever been in trouble and like were in solitary or whatever, just like dropped
them down to
onto
see
the
if they
ground.
could
They were like-
exist.
yeah, they're like, here you go, here's our experiment. We're just gonna release our children to the wild and hope they don't die. Is basically.
Yep.
But I feel like it went on for a little bit longer than it should,
Yep.
and I watched bits and pieces throughout the years as it continued on, and I was like, what is happening at this point? But it's based on a book series, if I remember
Oh, it is.
correctly.
Okay.
Yeah, so I don't know if the book series is any different than the show, but I do remember at least seeing part of that.
Yep. I remember staying up way too late watching that. And I was like, that was really pointless.
You like have
I
to know,
learned
like when you
nothing about it.
when you start, like you have to finish sometimes.
I know it is, because then it does bug
No.
you.
It doesn't matter.
You're
Oh,
like,
I
this is a
do.
waste of my life. Click.
And yet,
Well,
no,
there are
you
some
get
shows
sucked
like
into the
that
train
where
wreck.
I've been like, no.
Yeah.
Yeah, no, you just get sucked into the train wreck of what these things are. I mean, I watched 15 seasons of Supernatural, and there were some really sketchy seasons in the middle. When I say I watched 15 seasons, I mean for like 15 years. Like I started it when it came out when I was in
Unlike
middle school.
me, I'm on season 8 of Heartland, and it has not been 8 years. I think we just started it a month or two ago.
No, that was I watched it from the start all the way through the finish. And there were a couple times in the middle where I really kind of questioned my life as to whether I should continue the show because it got a little iffy. And then it would suck you back in. And it was like every time I was about to be done, something would happen. And I was like, dang it, now I got to finish this season. What am I going to do? But some of them will do that. But there are others that you watch a couple episodes and you're like, well, never getting that back.
I did do that with The Walking Dead. Like, I gave up on that, like, after years.
Yeah, I did too. I gave up on
My
Walking
dad watched the entire thing for the whole year. Like, every year it was on. He watched it forever. It was on for, like, 10 years.
Yeah.
Isn't it still on?
No, it's over now. Now they have a new thing.
Oh, I think they've got, like, 2 or 3 spinoffs. I don't know. I think I watched 2 seasons of The Walking Dead before I was done.
Good for him. He stuck with it. I
All right. Aliens have landed on Earth and have claimed one of your team members as their spy. You're not surprised at all. Who is it?
Becca, you can go on this one.
Oh, that's hard. I might have to say Schmoke. And I think it's because she's so sweet. They would talk her into it, and she may not realize that that's what happened. She may just be thinking she's telling stories about all of us and, being nice, but I think it would be Schmoke.
Interesting choice.
I'm going to go with Abby.
I would have picked Abby too. I picked Abby too.
Yeah, I was just like,
well, use it on your team.
She probably is already doing it.
I know, right?
I did too. I thought it meant like yours.
Yeah, you said
but
team.
if this opens up the
Opened
catalyst,
yes.
Ooh, maybe Sam.
Okay.
I could see Sam maybe helping some aliens out.
Okay.
I don't know. If we're opening it up, I might be able to see Kelly.
No,
Kelly Wall.
Kelly would be like, no, go away, bye.
See, I think if it would get them off of her back. That if she was like, listen, I'll tell you whatever you want as long as you just leave me alone. Like, leave me alone over here by myself. I think I could see it potentially happening. But that would have to be the caveat to that of like, leave me alone. I will tell you what you want. But as soon as you come at me, we're done.
Interesting question, Harrison. All right. Cases. What you guys have? Elise?
I don't have like a one specific case.
Okay.
But Cloud and I were talking recently because we have seen so many blocked cats recently. Like just in like the last couple of weeks. And she was talking and she was like, man, like I wonder if like it's like the weather or something. Because when it got warm out, like all these cats just blocked. And she was like, I wonder if like they're frustrated because they see birds outside or something. Like something's causing them to be like blocked or stressed. And she was like, Todd has also had a lot of blocked cats. Because I was like, well, we always see weird stuff here. And she was like, no, Todd has also had a lot of blocked cats. So I actually looked into it.
Okay, tell us what you found out.
They have done studies on that. And it's weird because it happens like mostly in the northeastern states, kind of like Midwest, northeastern, but not in the Northwest. But as it starts to get warmer, one study said like April to May and one said like March to May, they did have an increase in blocked cats. And so like they don't really like they still said like we don't know 100% like why cats blocked, but we know like it has something to do with like their like stress and sometimes like water intake and food and all these things. And they're like, but when it does get warmer, they see more blocked cats.
That's fascinating.
And they don't know if it's a climate thing. They don't know if it's like days getting longer. They don't know why it happens in like these parts of the states, but not the other part, like not the like Northwestern, the cases were much lower. But yeah, when it gets warm out, like in the springtime, cats block.
We're going to have to remember this next year when May comes around, April and May, and we'll have to be like,
start testing and see.
Like, see if we actually see another, there's enough cat patients now maybe that you might see those types of trends.
I mean, the herpes flare trend's definitely seasonal, but I don't know. I just always think stress.
Yeah.
Maybe owners aren't around as much.
Maybe like
the stress of because they're out and about doing things with the weather, maybe, or I don't know.
There's just so many variables.
Oh my gosh, yeah.
Spring cleaning, and there was like one weird article that like talked about like because they said like a lot of like blocked male cats are like neutered and overweight, and it had something to do with like like an adrenal gland or something because they were neutered. It was a really weird. That was a weirder article that I read about it. But a lot of them was like, yeah, we see instances of when it turns spring, they get blocked.
Yeah, fascinating.
It's really weird.
That's a really cool, like, case thing that you just talked about. That's
when she
neat.
talked about it, I was like, man, like it has like as soon as it got warm, like so many cats blocked. So I was like, I'm just gonna look into it and see. And there are a couple of studies on it. Like some universities did some studies.
Very cool. Fausti, what do you have?
Not really anything interesting. I think the most frustrating one recently was Jethro, that we did the second Stelfonta injection into his mast cell tumor and 0 response.
Really?
Yeah.
We just talked about Stelfonta in the last podcast, I think.
Oh, okay.
And McDivitt was talking about it, or somebody was talking. I don't remember what we were talking about, but and so the first injection, nothing.
Yeah, like he responds for 12 to 24 hours. So like right after the injection, it blows up. You see that it's doing its thing. He gets sore, super swollen. And then I think the first time after like day 2 or 3, it went down to nothing, super tiny, but then never changed from there. So like it just stayed like how the growth was before we injected. So then the second injection, it was the exact same thing. Like he, reacts while he's in the clinic on day 1 of the injection, and then it goes right back to normal. So it was just the small percentage that don't
I was going to say, I know there's a small percent that don't.
Yeah.
Is it smaller now, though, where you could surgically remove it?
No, it's no different than what it was then, but it's right on the hock to where like you would just never get margins. She did go back home for, I think, a vacation, and her uncle is a vet, so they did surgically remove it, knowing that
just to get
it off when it was tinier. But yeah, I think it's like 75% is good to go into remission after first injection, and then 85% after the second injection. So
it's just that 15%.
He's just in the small, yeah. But to just not have any reaction, like I couldn't find any data on that. And I reached out to the rep, and they said there should at least be some minimal draining. The first injection, he had like a pinpoint spot of drainage, I think at day like 7, but it was so minimal it did nothing. And then the second injection, he had no drainage.
Fascinating.
So
yeah,
that was just super frustrating. But yeah,
interesting case. Okay, I wonder, are they sending it in for histopathology?
Yeah.
Okay, because that'll be interesting to see.
Yeah, so I didn't know that they had removed, because it was like day 20 of the second injection that they jumped in with surgery.
Mm-hmm.
And I was like, whoa, like that is still in the tissues. I'm like, you need to let the pathologist know and all that stuff. There may be issues with healing. Let's remove the sutures like way, later than day 10. So I don't know. I think we're coming up on day 14. I don't know if they got results back yet. It just happened. But yeah, I'd be curious to see if it's a high grade that just wasn't, because those aren't typically responsive. But what were we going to do anyway?
Right.
So we had decided with the owner to give it a go. And then, of course, that was the case that didn't.
Yeah. Interesting.
Didn't do anything. So, yeah.
Becca, what do you have? Since you were thrown into the podcast, do you have a case?
Kind of. So Sirius, my dog, he had a dental with Dr. Cloud. It's been 2 weeks, 3 weeks ago now. And he's had a couple interesting things since. So kind of a PSA of keeping an eye. So first is when she actually had him under, we always do the full course. We do the full radiographs on his mouth. And she came around the corner and she goes, "So I have something for you." And I was like, oh no, what did he do? So apparently he's got weird pockets in his teeth. So his upper, I believe she said it was his upper molars, like in the back. He has these empty pockets above them. So she doesn't know if he has like a double abscess on both sides or if he's just weird. And that was her specific phrasing. She goes, I don't know if he's just weird or if there's something else going on. So she's like, for now, we're going to monitor him because he's eating fine. He's not dropping his food. There's no facial swelling, which would be signs of an infection going on up in those areas. But for now, he's fine. So the plan is...
He's a husky cross, right?
I believe he's a husky shepherd mix. He's kind of a mutt, but that's the general idea of what we have for him.
Was this his first dental?
His first dental. So he's 3.5 now. And he just had a little bit of extra tartar on the back. So we were like, okay, just go ahead, do it. Let's just clean him up. So the plan is to recheck him in about 6 weeks, 8 weeks, something like that. Make sure that he doesn't need to actually have them removed. But then because nothing is easy with that dog, you guys have all met him, nothing is easy. He has been licking at the place where we shaved his cat.
Oh, yeah. Mm-hmm.
So that's something that if you do have a dog that has a surgery site that we have shaved the hair, even if we shave it just because we're cleaning up a hot spot or something, you have to be very, very careful because they will lick at it. He is very itchy. So he's been in a cone for about a week and a half now. And it will be on for the future for quite a while because every time it starts to come off, he's looking at it again. So the spot is red, it's irritated. He hates his life. Every time he sees me come with that cone, he's like,
poor Sirius.
Again, really? Oh yeah. He doesn't know how to do anything in it. He can't eat. He can't go outside to go to the bathroom. He just freezes, so I have to take the entire cone off to get him outside. But it's kind of...
Can you do a donut, or is he just lift up and over?
He'll lift up and over. He's too smart for his own good.
He's got long legs.
He has long... Yeah, he's such a long, skinny kid that he can get to it. But... so it's kind of one of those just keeping an eye on your pets after they do any sort of surgery, even if it's something as simple as a dental where you're like, oh, everything will be fine. Nope. He's just licking, and that spot is just irritated from all the fur growing back from where we had to shave him. That, we're using like Gen 1 spray on it because he's not full infection. There was some little bit of infection, but nothing super bad. So no oral meds at this point, but it's just a matter of keeping an eye on him. So that would be kind of my thing is just anytime you bring them in for anything, keep an eye out afterwards because you can always find those random things that'll pop up once we do surgery or something, whether it's a hot spot from shaving. Some people end up with, infected suture sites, things like that. So it really is just keeping a close eye on your pets anytime we do anything for them.
Yeah. You should try Fovea on him, on that spot.
Yeah.
You would not be able to hold him still to do it. We would have to sedate him because you can't, he doesn't like his feet touched. And it's right there on his arm, so you would probably have to sedate him.
Sedate him.
Serious.
He's naughty. He's a pain.
He has such a rough life.
Oh, yes. Let me tell you, all of the treats and everything else. My mother came down to visit specifically to bring me his bark box and things that she bought for him at the farmer's market. He lives a rough life.
Yep. Well, my case is I think he was 7-year-old, actually, block cat that came in and was an interesting case just because he was blocked initially, and then we unblocked him, but could not resolve the debris that was in his bladder that resulted in him being blocked. So he actually had a cystotomy and then suffered from complications related to the cystotomy. And the end result, it's just an interesting case to me because the most likely scenario, well, we used Nocita on his sub-Q space as a pain control post-operatively. And we think he had a reaction to the Nocita. And his owner was like, yeah, he has reactions to everything. I was like, oh, okay, well, maybe that was part of the issue. But interestingly enough, so we had this reaction to Nocita. He had a hydronephrotic right kidney. And when we first started working through him after surgery with these complications, we assumed that the kidney was hydronephrotic right then, like right after the surgery. But I think what really happened was he had a right hydronephrotic kidney before.
Wait a minute.
Surgery.
Who is this?
It was Leo.
Yeah,
the Leo cat.
Oh.
Yeah, so I think when I put it all together, what I think happened is he has a right hydronephrotic kidney that was there from being blocked before, even before we even saw him a month and a half ago from that blocked episode previously. So because we didn't ultrasound his kidneys, we ultrasound his bladder, but not his kidneys. So my thought was, okay, he has this hydronephrotic kidney with retained urine that's sitting there. He has a reaction to Nocita and ends up with a secondary infection as a complication to the reaction to Nocita. He has retained urine in his right kidney, which is then a place for that bacteria to go and cause trouble. He has then developed severe pyelonephritis post-operatively. And so like so severe that he suffers from acute kidney damage and has required like a lot of intensive care, but he is so then what we ended up doing was going back and freshening his tissue margins and removing the affected tissue from the nocita, but then removing his right kidney because we were too afraid to leave it in place, even though typically we won't remove hydronephrotic kidneys because we thought this might be the story that was happening. We did not want to come back around and have it happen again. So, and his kidney function is now all the way back to normal. So he was a cat that had like unreadable creatinine, unreadable BUN, unreadable potassium, unreadable phosphorus, and now with a neutrophilia with bands, and now is reversed and is completely normal. And was required like severe intensive care to get to that place, but now is doing really well. So
cool.
Yeah.
Did he do well over the weekend?
He did well over the weekend. He is starting to eat on his own. That's our biggest thing right now is like getting, because he spent probably 5 days, 6 days not eating. And so now just like getting him turned back on to eating. His lab panel's normal. So he should, and he ate kibble periodically through the weekend.
Does he still have his tube in?
He has his esophagostomy tube in. So that's one of the things that we've started doing is in these cats that are severely ill, you can't really force feed them. It's really hard on them, and it's hard on the owners. It's hard on the veterinary staff. So we've decided to start putting in preemptively esophagostomy tubes, which allow us to deliver medications and food, so calories to these cats, which makes it way easier for them, I think, when you're treating them.
While under for the procedure.
So we automatically just put one in, whether, especially in these cases where they haven't been eating prior to the procedure, we definitely put it in. If we anticipate that we may have them and they're not eating post-op or not going to eat post-operatively, because you can pull it if you don't need it, you don't need it. But it's so much easier to have it, to deliver meds. It's just such a better hospital experience.
It was,
don't you think?
Yeah,
for the
it
cat?
was so easy to feed him and give him, because I watched him that Sunday, and you're just here by yourself, and like normally he is not super big fans of us,
right?
And so he was getting a little spicy that Sunday.
Yeah.
But so like when he's not super, he wasn't as spicy as normally is, but just hold a syringe right over here so he can't get you, and it's super easy to give him his gabapentin that way, and so it was a lot easier, and I think so much less stressful for his care.
Oh yeah, absolutely.
I know everybody was excited when he got to go home last week because we'd all been kind of keeping an eye on him, seeing what's going on, keeping up with the case, and I know everybody was excited when we're like, oh yeah,
there's been a lot of people
home.
Involved in his care, so it's yeah. It's been pretty emotional roller coaster. But yeah, so we'll give you an update once we see him back again this week. But so far, so good. All right, on to listener questions. Hi, I love your podcast. I'm a veterinary technician from California, and I wanted your input on FIP virus. Oh, California. In cats. If you can feature this in your podcast, it would be super useful. Thank you. At Jennifer._. I did that right?
Yeah.
And then we have a second question, which we'll combine with the first question. Do we have alternative therapy for FIP in cats? And is there any safe vaccine for it? FIP cases seem to be emerging in my country, and current therapy with antiviral GS-441542 is quite expensive. And that is from @ Alpha Rain 99. All right, Faust. Hit us. What you got?
I don't know what input she's won, but FIP just sucks. That's the bottom line. Is
there a different acronym for FIP? I mean, I know what it stands for, obviously, but because it sucks, has anybody created an ADR version or Send It to Jesus, an STJ, you know what I mean? Like an FIP version of what that stands for.
We'll have to start brainstorming. And
Yeah, we'll have to think of that.
They just got the FIP.
They got the FIP.
Yeah.
Yeah, well, for the listeners, why don't we describe kind of what FIP is?
Well, you got your dry and your wet version.
Okay.
And, people aren't going to like to hear this, but it's like a mutation of a coronavirus, which I think might freak people out. But people can't get it.
It's not that kind of coronavirus.
Can't get it from your cat.
Nope.
And it's just a mutation that some cats get, and
Been around forever. I don't even know when.
just the luck
I don't
of the
even know
draw.
when it
came out of nowhere.
probably a lab experiment.
It's
No,
probably
I'm just
been-
kidding.
I mean, has it been your whole career too?
Yes.
That's right. Yeah.
But I mean, I think they've learned more and
I don't
more
know.
over time.
Yeah.
So like when we first started out, it was like, oh, it's so highly infectious and this and this and this. And then they started realizing over time that some cats can fight it off and you move on and no big issue. And then you have other cats based on their genetics and, you know, potentially, you know, they just can't do that. And so then they have trouble with it.
Yeah.
But
It'll be great when one day we do have a FDA approved product that we can use.
yeah. But I think that right now, I mean, there's enough information about what coronavirus is or what FIP is, how to try and prevent it in cats. I mean, because there is no treatment. So then trying how to prevent it. And those resources are out there. So I think that would be a great. Now, this person lives in California. So you were saying that that's kind of the coronavirus FIP capital.
Yeah, UC Davis is like the hub of all that research. As far as I know, with the early starts of working on the GS 441524, but now they're also working on the GC 376, which I don't know when. I haven't heard as much about that one to know when that got tacked on with their research, but it's pretty promising. But yeah, to follow up with the second question, nothing is FDA approved in the United States. So I think people that are asking about it, you know, there's a lot of different like FIP warriors and some other Facebook and groups online that, you know, you can access some of this stuff on the black market. But I think the main concern is accuracy of the drug concentration and then purity. So it's not something that we can recommend at this time.
Yeah. And I think just to let everybody know, because I had to do some research on the antivirals. I mean, basically they're a nucleoside analog that interferes with viral replication. That's how they work. So it's still experimental, like Faust said.
It's legal over in the UK and Australia. And I think they're using the injectable version. I read one thing about somebody's trying to come out with an oral, but I don't think that that's the one that's approved over there. I think it's still the injectable.
We don't have any vaccines. So we still don't have those, you know, to answer that part of the question. So hence why when we opened up the conversation, we said it just sucks because there really is very limited options that we have. And most of the time we're supportively treating these patients to try and keep them comfortable and address some of the secondary issues that they might have related to FIP.
Is there an actual test to be able to say, yes, for sure, this is FIP, or is it a process of elimination, if I remember correctly?
Yeah, you're right.
Yeah, because I know we had 2 kittens. I mean, this was, early when I was working with you, that one of them just wasn't thriving. He just wasn't doing well. We could never get him, better. And we did all kinds of blood work. We did x-rays on him. I mean, so many things. I think we had finally decided that FIP was his diagnosis.
Yeah.
And I think he passed either right before or right after he would have been 6 months old. The brother, on the other hand, who was from a different litter, they weren't from the same litter, but they were living in the same household, totally fine. He's thriving. He's 3 or 4 now.
Yep.
And doing great. But the other one there was nothing we could do. I know that we had tried B12 injections. We had done.
Yeah, he was on steroids
things
at that point. And I mean, he was kind of like a little bit more of a slow progression. So we had some time to
try a couple different things.
Yeah. But I mean, it is what it is. Eventually, his body.
Yeah, because when he went downhill, he went down very quickly, unfortunately. Yeah. And I know I came in after the weekend, and Terry Hindenburg, who does all of our euthanasia calls and things like that, had asked me about it. She goes, "Oh, do they have kids or anything like that?" And I looked at it and I go, "Wait, what?" She goes, "Oh my goodness, you didn't know that happened while you weren't here?" And I was like, "No," because we'd been working so closely with them and the family. And I mean, it was heartbreaking because we kind of already knew that there was nothing that we could do. But because of how quickly he went downhill, I think it was kind of a shock for all of us when we did come in, because it was a day that we were all off, to see that they did have to unfortunately euthanize him.
That's always so hard when it's you get a young animal and you're thinking, you have all these, you're starting from scratch and you have all these years, and then you come to find out they're sick or whatnot. That's always really hard.
Yeah,
I think
especially when they got the two kittens together in that situation, and then it was like, oh great, now the other one doesn't have a buddy, and it was
and
just
I know they
hard.
were so worried about the other one, about how he was going to react when they didn't have them, and even just every little thing for a while. Anytime he had a little bit of a cough or a sneeze or something like that, I was getting phone calls and talking to them and making sure that the other one wasn't going to have any issues, because they were so worried, because they did just go through this. I mean, it's kind of traumatic. You get these two kittens just to find out, a month or two later that one of them is extremely sick. So they were very careful about the other kitten for a long time, trying to make sure that he was healthy and everything was fine. And that, because I had a couple conversations, I'm like, "You're not overreacting. I understand where you're coming from. I'm happy to talk to you about this and, help calm any fears that you have, because you did go through a lot with the other one."
Yeah.
I feel like my last couple FIP cases have been awful, where like the owner, like one of them, they had just euthanized their like 19-year-old or 20-year-old cat, and then they go to the shelter and get a new cat.
Yeah.
And then like 3 months later, that was the diagnosis. And I was like, oh my gosh.
Yeah.
Like, what are the chances?
Right.
And then, Becca's case followed. And I mean, it was just like.
And there's no way, because I can hear people's brains turning at home, when they hear this, they go to the shelter and get a cat. There's no way to know that the cat doesn't have FIP. That's the hard part. I mean,
so many of them, like, that you're testing for, like most of the time we're testing for like leukemia, AIDS, and toxo if you're doing that one panel that has the corona on there. And it's like they're almost always positive, whether it's from like previous vaccine, previous exposure. So like there's just no way to know when you're picking out a kiddo if they're going to have an issue or not.
Yeah.
Yeah, it does just suck.
All right, we got to come up with the 3 words for the FIP.
Oh gosh.
Yeah. Oh gosh. All right. Well, hopefully that information's helpful. And if you guys have any other questions in regards to that virus, don't hesitate to reach out. Thank you so much for listening and turning into another episode of the Veterinary Roundtable. Remember, send in those questions and be sure to follow us on all social media platforms at All Star Veterinary Clinic. If you enjoyed this episode or previous episode, please leave us a review on your podcast provider of choice. We'll see you in a few weeks for the next episode of the Veterinary Roundtable. Thanks, everybody.
Bye.
See you next time.